Hi everybody, this is the next in our series of Tell Me in 10, and it is about radiologist responsiveness in inflicted injury or child abuse. I'd like to make a special thanks to Dr. Shoiba Saldana at Enfold India in Bangalore and Dr. Aman Daftari for their contributions in this talk. What we will talk about today is the extent and nature of the problem in India, some radiologic findings, and how to respond. So there are a bunch of terms that have been used associated with child abuse, and these include the old terms of battered baby and child abuse, the more recent terminology of non-accidental injury, and the current preferred terminologies of suspected physical abuse or inflicted injury. These are just newer terms that one should start adopting, as the previous terms are a bit more obsolete now. So when we think about child abuse, the UNICEF, we will talk about the definition. We'll talk about where and how does it happen, and we will talk about why it's important. So child abuse, according to UNICEF, is the physical/mental abuse or injury of a child, neglect or negligent treatment, exploitation, and sexual abuse. It happens in homes, schools, orphanages, residential care facilities, on the streets, in the workplace, essentially any and everywhere around us. And it's extremely important because it has horrible detrimental effects on the developmental, physical, mental health, survival, and dignity of children. So let's take a look at how India's children are doing. According to the 2011 census, we had 440 million children in India, 40% of whom are vulnerable, a quarter of whom dropped out of school, and about 10% of whom are involved in child labor. In terms of their nourishment, we have about 20 million children under 6 years who are undernourished, 38% of whom are in the 0 to 5 year age group, 21% have wasting, and 36% of under 5-year-olds are underweight. In terms of the girl child, 42% of married women did so as children. 4.5 million girls under the age of 15 are married with children. 70% of those with children have 2 children, and 1/3 of child brides in the world are from India. What's our government spending like? About 3.2% of the budget targets children. This is 3.2% targeting the future of our country. The overall budget has increased by 13%, with the child budget only by about 11%. What happens to our children? According to a study in 2007, which only looked at a very small number of children, which again indicates to you how low this is on the list of priorities of studies in our country, maybe about 70% of children report physical abuse, 89, almost 90% by their parents. You can take that home and let them know to your parents as well. More than 5, more are in the 5 to 12 age group. About a half of them could be sexually abused, 21% severely, about a 50-50 relationship between boys and girls, and more than 50% would have undergone more than 2 forms of sexual abuse. There is an estimated increase in 5 times the number of crimes against children over the last 10 years. And during the pandemic, this is only expected to become much worse. And fear of failing in exams is the second highest cause of deaths in India, as was demonstrated by the movie Chichore, for those of you who saw it. The Global Status Report on Preventing Violence Against Children in 2020 from the WHO says that 1 out of 2 children are exposed to abuse. There are specific rules that they have prescribed in terms of improving the status of these children. And these rules, following them, can result in 20 to 50% reduction of the incidence of child abuse. The COVID-19 outbreak brings abusers and abusees in close proximity to each other for longer periods of time, and therefore abuse has only increased. The most important thing I found in all of this is that there are a few approaches that are supposed to have very high impact, and these are not really being implemented in low-income countries. So these are the things that we're going to try to do. What are the small things that you can do to make a big difference? So again, this is the WHO Global Status Report on Preventing Violence Against Children. So do you still want to sit quiet? And the question that we always have, but I'm a radiologist, when would I see this? Now, there are 3 potential situations in which you would see this. 1 is while you're reading imaging studies. 2 is when you see patients while doing an ultrasound or a procedure. And 3 is when you're asked to work up a child specifically for non-accidental injury. In the first 2 instances, what we would like for you to do is to be alert. You need to be alert while you're reading imaging studies and while you're seeing patients to look for signs of abuse. And when you're asked to work up a child for non-accidental injury, the key thing is for you to be sensitive. You need to realize this is a sensitive time for the child, the family, everybody around, so you need to be aware of that. So what should you look for? On radiographs, you're all familiar with the highly specific, moderately specific, and less specific findings. And then on clinical examination, some of the findings we'll talk about. So in terms of the imaging findings, I think there's a whole bunch of them, but the most important ones are to be able to identify metaphyseal corner findings. And these are important because they're very, very specific to child abuse. Rib fractures, particularly posterior, skull fractures in specific distributions sparing the parietal bone, scapular, sternal, outer third clavicle fractures are very, very specific signs. Bilateral fractures of differing ages, digital and long bone fractures, especially in the non-ambulatory kids, vertebral fractures, epiphyseal separation, and skull fractures are other areas. So the one sign I'm going to focus more specifically is the metaphyseal corner fracture. This comes because of a twisting during the abuse pattern, and therefore you see the metaphyses twist off and you get these corner fractures. And this is really important for you to be able to identify. You could easily miss this. So here's a close-up of that metaphyseal corner fracture with a little bit of callus formation, and here's an arrow showing it to you. What could you mistake this for? For those of you who are very, very interested in syndromes, Menkes kinky hair syndrome, which I can pretty much guarantee you'll never see in your life. Blount's disease is something that you would see and you might mistake this for that. Remember that this will be usually unilateral, may not be bilateral, so you want to be careful about that. Healing rickets will give you sharp margins. Those will tend to be bilateral and across multiple bones. This will tend to be on a single bone. And then various metaphyseal dysplasias. Another pattern of metaphyseal injury which you can easily miss on this radiograph, for example, which looks relatively normal, but when you zoom down on the inferior aspect of the tibia, you can see that there's this entire bucket handle fracture. You see this arrow? This entire bucket handle fracture of the metaphysis. And this is again a really, really specific finding for abuse. So if you see this, you really don't have to think too much. You know this is a child who has undergone non-accidental injury or inflicted injury. And again, the differential considerations remain the same. Other things are posterior rib fractures, and here you can see some have more callus, some have less callus. So multiple posterior rib fractures, especially of differing ages, is something to remember. Distal clavicle fractures is another thing that's important to remember. These can happen from regular trauma, but remember, if you see these, to at least check that the pattern or mechanism of trauma is concordant with the kind of injury the person had. Sternal fractures are another thing that you have to look for very carefully. Here's a slide from the internet. And that's another area that's quite specific. Long bone fractures, especially in those who are not weight bearing or walking around. So this is like a 1-year-old kid or less than 1-year-old who's not walking, and you can see a mid-shaft femoral fracture. And this is something that you should be alerted towards being non-accidental injury. So long bone fractures in the non-ambulatory is another thing. When you're looking at head CTs, if you see cranial fractures in the parietal bone, that's relatively okay, and we expect that. But anytime you see widening of sutures, you see multiple fractures, you see non-parietal fractures, you see depressed or signature fractures, you should be very, very concerned. If you see intracranial bleeds that are in the form of diffuse axonal injury involving the deep structures and the mechanism of injury is not concordant with that, then you should be looking for this very often. So if somebody says, nahi wo gir gaya, and you notice that there's this, a diffuse axonal injury type bleed, then you've got to be very, very careful to say, well, this doesn't make sense, the story doesn't make sense. From the imaging findings, the signs of physical abuse, and this is where you have to remember when you're in an ultrasound room and a patient walks in, or you're doing a procedure and a patient walks in, these are the things you need to keep aware of. So one is the child appears more fearful of the adults, especially the attendant. The child looks malnourished and unkempt, disproportional to the attendant. So the person who's with them looks well dressed and healthy, and the kid looks really shriveled and scrawny and scared. The injury patterns, bruises of varying ages, specific shapes of bruises like belts, ropes, cigarettes, rulers, pinch marks. Look carefully when you're doing a transvag or when you're doing a pelvic ultrasound. Make sure you also look. Don't just put your transducer there. You never know what you might find in terms of injury. And face and mouth injuries. In terms of the attendant, the person who's coming with the child, they'll seem sort of a little bit unconcerned about the child. They'll sort of make very flippant comments that the child is clumsy and careless. They will limit the ability of the child to talk to him and say, no, he doesn't know anything, or she doesn't know anything. So be careful about that. These are your clues to start thinking about this. And what should you do if you suspect abuse? I think the most important thing you need to do first is you need to confirm, because as we've shown you before, these findings of abuse can look like metaphyseal dysplasias. They can look like other things. So when you put somebody down the path of abuse, you're also putting the parents through significant trauma if it's not the case. So be sure, and the ways to be sure are to get the images reviewed by another experienced radiologist. And the ideal way to do this is with WhatsApp. You can send the images to many people now to get an opinion on it. Call the referring physician and speak to them, but speak to them discreetly. Don't do it with the patient in front of me. Hey, hello, is this patient got abused? No, you got to go to the side of the room and speak to them separately, quietly. Say, look, I'm concerned about this. Do you think there's any chance of this? Be very careful in your conversations. And then consider getting a skeletal survey done to look for other fractures. During the time that you're doing your thinking and confirmation, make sure you try and protect the child. Be kind, be considerate, be discreet. So make the child comfortable, make the family comfortable. Just sit there, make it sort of very unassuming. Keep the child in the facility to figure out what the next plan is. If you're in a hospital and perceive imminent danger, you can admit or have the child admitted, speak to pediatrics, speak to a psychiatry, somebody else who can help you out. If you're out of options completely, you can call Childline with 1098. This is a nationwide number that you can call, so call that. And you can give the child or non-offending person or parent the number to call if they sort of seem like they have to go and there's nothing you can do. Then this is your last ditch attempt, is to give them that number. But remember, during all of this time, don't waste time. So be discreet, be careful, but hurry up and make sure that you confirm and make sure that you protect. What's the strategy to containing the whole issue of abuse? Number one thing where we are going to make a difference is by suspicion. So we are going to be alert and aware when we see a patient and when we look at their images to think about the possibility of abuse. The second thing we're going to do is we're going to confirm. Whenever we see this, we're not going to have a knee-jerk reaction to just go ahead and say, oh my God, there's abuse. We're going to spend a little bit of time, we're going to take the time out of our day, and we're going to confirm this. And while we're doing this confirmation, we are going to make sure that the child remains safe. Okay, so those are two very important things. And in the long term, these children will obviously need rehabilitation with psychiatry and psychology and a bunch of other things. So I think the key thing for you to remember is child abuse is all around us and it's growing tremendously. It's 1 in 2. So if you're not seeing it, there's something wrong in the pediatric population you're seeing. Okay, for a change, radiologists can make a difference. What are the things that you have to remember? Suspect. Be alert and aware whenever you're looking at a scan that this is a possibility. Look for physical and behavioral signs when you see patients, and look for imaging signs when you actually look at the studies. Protect. Keep the child safe until you confirm, and be discreet. Confirm. You don't want to put somebody down the path of abuse when there's no abuse. So make sure you consult an experienced person, discuss with the referring physician, and maybe complete a skeletal survey to get an idea of what's going on. When it comes to acting, if you have the resources around you of other physicians, of a hospital, of an environment with social services, obviously go down that path. If not, your last ditch is to call 1098. That's 1098. Call this number. It's a nationwide number, and they'll be able to help you with what needs to happen. So remember to call 1098 if you have a problem. So child abuse, again, guys, very, very important area for us in our lives. It's the one place where radiologists can make a difference to a child's life, and I encourage you to do this often, to think about this often, and to be alert and aware of this and act responsibly. Thank you.